Good morning, everyone. My name is Lenzie and FARROL, and I would be the night reporter for the topic 2 personality assessment methods, the behavioral assessment methods. Good morning, everyone. My topic outline for this report would be the the introduction to what is behavioral assessment method and the who, what, when, where, why, and how of behavioral assessment. My intended learning outcomes for this topic would be is for the students to able to understand what is behavior assessment methods and to and for them to be able to understand the who, what, when, where, why, and how of behavior assessment methods. First, we would like to know what is behavior assessment. Behavior assessment is a structured study and analysis of a person's behavior using various methods like interviews, direct supervision, and self-observation. It refers to the process of observing, explaining, and predicting human behavior with the help of new age digital tools. These include such assessments as the interview, rating scales, self-reports, personality inventories, projective techniques, and behavioral observations. And these are the constructs whose existence must be inferred from behavior. These are the traits, states, motives, needs, drives, defenses, and related psychological constructs that have no tangible existence. In the traditional approach to clinical assessment, tests are, as well as other tools, are employed to gather data. From this data, diagnosis is and inferences are made concerning the existence and strength of a psychological construct. The emphasis in behavioral assessment is on, quote unquote, what a person does in situation rather than on the inferences about what attributes has more globally. Predicting what a person will do is thought to entail the understanding of the assessee with respect to both unintended conditions and consequences of a particular situation. In a traditional assessment for behavior assessment, it is more likely to evaluate the traits and states of an individual, collectively referred to as personality. In traditional assessment, an individual's behavior history is afforded with great weight, almost but not quite to the point of being predictive of future behavior. There are two types of traditional approaches to clinical assessment. The first approach is the sign approach, and the second is the sample approach. The sign approach is a test response. Is a test that test responses are deemed to be signs or clues to underlying personality or ability. The sign approach is more likely to interpret specific behaviors such as perseverations or weaknesses on the side of the body, which is highly indicative of the presence and nature of an organic impairment. While the sample approach focuses on the behavior itself, emitted behavior is viewed not as a sign of something but rather as a sample to be interpreted in on its own right, or what implications or indexes that becomes the underlying causes of a behavior. Now let's move on to the process of a behavioral assessment. The first one is the interview the client about his or her problem. The second one would be administer an appropriate test to the client. The third one would be the Ask the client to keep a detailed diary. And lastly, observe the client's behavior. Now, let's proceed to the next topic, which is the who, what, when, where, why, and how then. The first question is who. There are two sub-questions for who, which is the who is the assessee and who is the assessor. Who is the assessee is the person being assessed, maybe for example, a patient on a closed psychiatric ward, a client seeking help for guidance at a counseling center, or a subject of an academic experiment. Regardless whether the assessment is for research, clinical, or other purposes, the hallmark of behavioral assessment is to is the intensive study of individuals. This is in contrast to mass testing of groups of people to obtain a normative data with respect to some hypothesized trait or state. Now, who is the assessor? Depending on circumstances, the assessor may be a highly qualified professional or a technician assistant trained to conduct a particular assessment. Technicians are frequently employed to record the number of times a targeted behavior is exhibited. In this context, the assessor may also be a classroom teacher recording, for example, the number of times a child leaves her or his seat. An assessor in behavioral assessment may also be the assessee. The next question would be what, which is what is measured in behavioral assessment. The behavior or behaviors targeted for an assessment will vary as function of the objectives of the assessment. What constitutes a targeted behavior will typically be described in sufficient details prior to any assessment. For the purposes of assessment, the targeted behavior must be measurable, that is, quantifiable in some way. The next question would be when. When is an assessment behavior made? One response to this question is that assessment of behavior is typically made at times when problem behavior is most likely to be elicited. There are various schedules which behavior assessments may be made. The first one would be the interval recording or interval recording. Assessment according to this schedule occurs during a predefined intervals of time. An example of this is every minute or every 48 hours or every third of the week. Now the next is the frequency or event recording. The event recording is when a targeted behavior occurs, it is recorded. Beyond merely tallying the number of times a particular behavior occurs, the assessor may also maintain a record of intensity of a behavior. The intensity of a behavior may be gauged by observable and quantifiable events, such as the duration of the behaviors, stated in numbers of seconds, minutes, hours, days, weeks, months, or years. Let me introduce the methods of recording the frequency and intensity of a target behavior. The first one would be the timeline follow-back or methodology or the TLFP. A feature of TLFP is that respondents are prompted with memory aids such as memorable dates, including their birthdays, holidays, events in the news, and events of personal importance to assist in recall of targeted behavior during the defined timeline. From this recalled information, patterns regarding the targeted behavior will emerge. The technique may use the may be used particularly useful in identifying antecedent stimuli that cue the undesired behavior. The, mat- the method has been used to evaluate the problem behaviors as diverse as gambling, maternal smoking, HIV risk behaviors, and alcohol or medication abuse. Though its utility will vary by situation. The next one would be the ecological momentary assessment. Another assessment of the methodology entails recording problem behavior related events such as drinking, smoking, and so forth, not too retrospectively, but as they occur. This is accomplished by means of a handheld computer used to maintain an electronic diary of behavior. Now, let's proceed to the why question. Why conduct behavioral assessment? Why conduct behavioral assessment? Because data can be derived from behavior assessment can be used to provide a behavioral baseline data with which other behavioral data accumulated after the passage of time, after intervention or after some other event may be compared to provide a record of the assessee's behavioral strengths and weaknesses across variety of situations. There is also to pinpoint environmental conditions that are acting to trigger, maintain, or extinguish certain behaviors. Also to target specific behavior patterns for modification through interventions and to create graphic displays useful in stimulating innovative or more effective treatment approaches. Lastly, the how question. How is behavioral assessment conducted? The answer to this question will vary, of course, according to the purpose of assessment. In some situation, the only special equipment required will be a trained observer with a pad or pencil. In other types of situation, a highly sophisticated recording equipment may be necessary. This would end my report, and thank you for listening. Again, my name is Lenzie and FARROL, and have a good day, everyone.